Northeast and Caribbean Mental Health Technology Transfer Center, or MHTTC, housed at Rutgers School of Health Professions, Department of Psychiatric Rehabilitation. My name is Joni Dolce, and I'm a project associate with the MHTTC, and will be facilitating the webinar today. The MHTTC is funded by SAMHSA, the Substance Abuse Mental Health Services Administration, to enhance the capacity of the behavioral health and other related workforces to deliver evidence-based and empirically supported practices to individuals with mental illnesses. Please visit the MHTTC network website for additional information at mhttcnetwork.org. Before we begin the webinar, I wanted to quickly review some housekeeping items. We have a listserv that we encourage you to join so you can keep up to date with all of our activities and offerings. We'll include the link to our listserv and enable you to sign up for it in the chat box. We also wanted to let you know that today's webinar is the second in a series of webinars we'll be hosting over the next several months on the practices that support recovery from serious mental illness. We'll include links to register for these upcoming webinars in the chat box as well. We wanted to encourage you to complete the survey you will receive via email following today's webinar. We value this feedback and we use it to improve our activities and inform future activities. The surveys are also important because our continued funding is linked to the completion of these surveys. So we thank you in advance for your feedback. We also want to let you know that this webinar is being recorded and will be posted to our website. Lastly, this webinar will be interactive. On your screen, you have a taskbar with buttons that say Q&A and chat. Please use the Q&A feature to ask our presenter questions throughout the presentation. I'll collect your questions as we go and ask them of the presenter during the Q&A time toward the end of the presentation. During the webinar, our presenter may pose questions to you. Please use the chat feature to answer these questions. Now let's begin our webinar, Supported Employment, How to Support Someone with Obtaining and Maintaining Employment. We're fortunate enough today to have Francine Bates, who has been providing career and employment counseling for 25 years. Early in her profession, she has worked as a vocational specialist, then the manager of a supported employment program providing services to individuals with mental health conditions. In 2001, Dr. Bates was hired as faculty in the Integrated Employment Institute in the Department of Psychiatric Rehabilitation and Counseling Professions, which now resides at Rutgers, the State University of New Jersey. She has worked with a variety of mental health programs and agencies in New York, New Jersey, Pennsylvania, and the state of Washington. Her master's degree in counseling and her doctorate in educational leadership provides a blend of skills that promote effective training of mental health staff. Dr. Bates specializes in the expansion of evidence-based employment services and employment parity for individuals with mental health conditions. Additionally, Dr. Bates develops training manuals and conducts research on the topic of employment services. Her most recent research explored the employment decision-making process of individuals in recovery and who are receiving supplemental security income. Dr. Bates has co-authored several workbooks and manuals, including topics on peer employment support, employment services, train the trainer, individual job search skills, and decision-making. Please welcome Dr. Francine Bates.
Hello, Francine here. And I will have to say that I'm very glad to be presenting on this topic that I'm very passionate about, employment. I personally gain so much from my work and believe that employment offers more than what we see on the surface. Today I'm presenting on two related employment topics: supported employment as a federally defined legislation and supporting someone in employment. Both assist people in deciding and selecting an employment path and preparing for and gaining a chosen employment, career, or job. And then the support of someone in keeping that job or moving on to other work for reasons such as career advancement. Today's objectives will cover the role of work in recovery from a mental health condition and the features of supported employment services and the principles of the evidence-based supported employment. I will be presenting resources to assist you in your endeavor to support someone in their employment pursuits. This quote from the Acting Deputy Assistant Secretary from SAMHSA really highlights the benefits of employment in increasing self-esteem and recovery. So employment is seen as recovery, as a way to recovery and increase self-esteem. Recovery from mental illness has been studied and documented by researchers, practitioners, and individuals with lived experience. Recovery is real. Recovery can be supported by practices and services that encourage participant engagement, community inclusion, valued social role, and overall wellness. I'll be talking about one such practice, supporting someone in the pursuit of employment. Pat Deegan, who has a PhD, and she's a national leader of the consumer leader, and her quote is, "People need something to organize their recovery around." For many people, that something is work. So I'm not going to show this video. It's just a 4-minute video that the link is there. I'm going to encourage you to watch this link. And one of the reasons is Pat talks about her experience when she first got diagnosed with mental illness and had some difficulty with having people understand that she wanted to live a full life and be in recovery. She ended up getting a PhD and is a leader in our profession. So it's really worth watching, and it's very encouraging to see someone who talks about where they came from and where they are now. So just to start out, I think it's really important to think about and know why we encourage someone to have employment or work towards employment. So there's clinical benefits, and all of this has been researched and shows that employment doesn't increase symptoms, it doesn't increase crises or hospitalizations, but actually it helps to reduce crises, services, and hospitalizations. It also decreases symptoms, or there's no increase in symptoms because of employment. It also assists in decreasing substance abuse. But besides these wonderful clinical benefits, the additional benefits include increased income, improved self-esteem, improved social networks, and increased quality of life. So there's some really good underlying reasons why we would want to assist and help somebody in becoming employed. Also, looking at the flip side, when somebody's unemployed and doesn't have a job, there's been studies showing that increase in substance abuse, higher risk of depression and anxiety, reduced self-esteem, and an increased chance of poverty and homelessness. Additionally, the loss of social contacts and alienation. These are very devastating things that can be mitigated by employment for all of us, including those with a mental health condition. So some of you may see that this is familiar, a familiar slide, and I'm going to ask you to think about how do each of these wellness circles or wellness pieces, how are they benefited by employment? So I might use for an example, say intellectual, having a job, needing to think through different problems, using your mind to on the job can really be beneficial to a person's wellness. So this is the wellness circle that was adapted from Peggy Swarbrick, another leader in the field. And I'm wondering if any of you in the chat box can give an example of how some of these benefits of employment or some of these wellness circles can be benefited by employment. So
mentions the social aspect, new friendships at work, emotional, the self-esteem, physical, someplace to go every day, people have to go to work every day. Employment
No. And this one. Chuck.
Or are able to
Hello.
and able to see how this wellness relates to other employment relates to other areas of wellness.
thank you, Joni. So there's many different ways that employment can benefit an individual besides financial. So I want to mention employment services can be looked at and understood in a number of different ways. There may be some pre-vocational stuff that people do to help somebody prepare for employment. There's transitional employment where somebody works at a temporary assignment, giving them work experience before they move on to employment. But employment can also be integrated into other programs. Say the ACT teams, the Assertive Community Treatment. There's some employment services that are being provided in housing projects. And then there's what's called supported employment. One of those supported employment types from Boston University is known a lot of times from Choose, Get, and Keep, because it helps somebody choose the career, helps them get the career, and then works to keep the career. One of the things that I'm going to be talking about a little bit more today is the individual placement in support, or IPS, because it's evidence-based and there's been lots of research done on it in the success of assisting people in getting employment more so than other employment services that are provided. So what is supported employment? This is a competitive employment in an integrated setting with ongoing support services for individuals with the most severe disabilities. That's a quote from the legislation that funds supported employment programs in our nation. It was first implemented in 1970 for persons with developmental disabilities. And it was adopted early in the 1980s here in New Jersey for persons with mental illness, and it has spread across the country. Also within this legislation, employment needs to be individualized and customized, consistent with an individual's unique strengths, abilities, interests, and informed choice, including ongoing support services for individuals with the most significant disabilities. So back in the 70s, legislation began to pave the way And there's been additional legislation that has further developed what we know as supported employment and what it offers to individuals that we may work with. One of the things that I think is very striking is the availability of supported employment in our nation and in some of the jurisdictions like Puerto Rico and American Virgin Islands. This particular slide shows some of the states that have some of the highest supported employment programs per facility. So, for example, Wyoming has 48 mental health facilities, and this is based on a national survey that's done annually by SAMHSA, and it surveys all known mental health treatment facilities in all 50 states and other jurisdictions, including the District of Columbia, Puerto Rico, and this comes from the link from the 2018 resource, and it has lots of information about all the different mental health programs in the state. And it includes nonprofit, for-profit, private agencies. So again, for example, Wyoming, who has 48 facilities in the state, there are 25 supported employment programs in that state. So they have a 52% supported employment offering in that state. So this particular slide, I took all the different states that had 30% or higher of supported employment. So even if you can see that only 52%, which is the highest state that offers supported employment, a lot of the states have 30% and or lower. So these are the states that have the highest offering of supported employment within their mental health programs. This next slide shows the states that have the lowest offering of supported employment. For example, Pennsylvania, that has 561 facilities in the state, but they offer only 55 supported employment programs, so they're less than 10%. So all of these states on this particular slide show the very low percentage of facilities that offer supported employment at their programs. So if you look up, and I think at the resources at the end of this presentation, you can look up your own state and see where you stand as far as supported employment being offered in your state. So one of the things that I'd like to say is how important it is for us as professionals to be looking for ways to help assisting somebody in employment, building up the supported employment programs in our states, and to offer people the opportunity to gain employment with the support they may need. And so thinking of ways of how we can go about it. So let's talk about IPS, the individual placement and support model. Again, it's evidence-based, and this particular slide shows the 27 randomized controlled trials that were done on IPS, and the black line shows the different studies, the percentage of people that acquired employment in these studies, and the red line shows other employment services that they were compared against. So IPS model is shown to be much more effective than other types of employment programs that are offered. This particular page shows the different resources for somebody who's interested in finding out more about IPS, individual placement and support. SAMHSA has a toolkit to assist somebody in building up a supported employment program. and a lot of resources that they would need to do that. There's also the Supported Employment Fidelity Review Manual that has a lot of really good information in it. And then there's the IPS Employment Center that has a community of service providers that are providing IPS, and a lot of the statistics of those particular programs across different states are being collected and offered. So at the end, again, there is links to these different resources, and I would suggest you to find them and review them and get additional information about the strengths of IPS. So IPS is based on 8 principles. And I'm going to talk a little bit about each of these because they're very important in providing a holistic approach to employment for individuals. The first principle is zero exclusion. So the principle stands for it's open to anybody who wants to work. Eligibility is based on the person's choice, and people are not excluded because of a diagnosis, recent hospitalization, criminal history, or work readiness criteria. Somebody comes to you and says, I want to work, then that's the reason why they should be incorporated into being assisted. Integration of employment and mental health services. So anybody that works as an employment specialist will meet regularly. It's encouraged to be weekly with a team of other providers to talk and coordinate services between a therapist, medication, housing specialist, and employment services. So everybody's talking the same language, everybody's on the same page, and they're all working together in support of an individual in becoming employed. So competitive employment is the goal. We're not looking to find people find jobs for people that it wouldn't include volunteer jobs, it wouldn't include segregated employment, but competitive employment meaning out in the community, making at least a minimum wage, integrated with other people that do not have disabilities, and that's the goal of IPS. Benefits counseling is very important for individuals who are receiving any sort of long-term disability insurance, such as Social Security disability or supplemental security income. For somebody that goes to work that are on any of the Social Security programs, it's vital for them to know how work is going to impact their benefits check. So one of the things that can happen is some people at some programs are versed in benefits counseling and that provide those services right at their agency level. There's also people that are experienced that are funded by the Social Security Administration to assist individuals in benefits planning. And I would encourage anybody who is looking to find employment to meet with somebody who knows about benefits and the work incentives for somebody on Social Security. The rapid job search is another principle. So what happens is somebody who comes into a supported employment program, an IPS program, that we as professionals work at the speed of the individual, at their comfort level, but to work at getting a job, searching for a job as quickly as possible. That we're not going to spend a lot of time doing a lot of pre-employment discussions, making sure somebody's ready for work, but are offering a job search quickly. Follow-on services are also part of the IPS program. That no matter how long a person is working, if they need their services, if they need the support to maintain employment, those should be continuous. If somebody loses their job because of whatever situation it is, that's seen as a learning experience, and their services will continue in assisting and help them in becoming reemployed. Client preferences are important. So work that we do is, and jobs that we find for individuals are based on what preference does the client have. Not having employers that are willing to hire someone we're working with, but finding jobs specific to an individual that we're working with. Finding them the unique job that works for them. And also targeted job development, meaning that an employment specialist is out meeting employers, developing relationships with employers, finding out where those employment job opportunities are, and meeting with employers at least 6 times in a week. So it's seen as very vital. It's seen as a necessity to have continued contact with employers, develop those relationships for employment to be successful. So what I'd like to do is is choose, get, and keep. And I'm not specifically talking about the choose, get, and keep model that Boston University developed, but using those words as the process that somebody goes through when they decide that they want to become employed. So supported employment supports a person in deciding and choosing the type of work that they want, and then of helping them obtain and getting a job that matches their choice, and maintaining or keeping that job, or regaining other employment if for some reason they lose a job or go on to career advancement. So I'm going to ask this question: what resources are you aware of that are available for individuals at each of these stages? So ORS services, yes, absolutely. Anybody else have any other options? Employment centers. So there are resources out there available to people. I think the WIPA, yes. WIPA is the work incentive planners, and they're the ones that can help somebody with benefits planning, ticket to work, county, state, and federal funds, Access VR. The WIPA is one of the ones that probably would be used before somebody gets a job. The other ones certainly are places where people could go to gain the employment that they need and want. And then mental health providers, and I'm glad somebody mentioned that, because mental health providers across the board, not just supported employment people, but everybody that works in the field of mental health can support and do things to assist somebody in becoming employed. Prevention and early intervention, somebody mentioned. And WIPA helps to keep a job. Okay, thank you. So I'm going to walk a little bit more detail or give a few more suggestions about how somebody could be assisted in choosing a job. So I'm going to ask, what do you do, or what do your programs do right now, currently do you offer, that help somebody in identifying some of the most valuable things that a person can look into when deciding on the job they want? Their values, their interests, their preferences, and their skills. So is there anything in your agencies that you do at this time to engage somebody into choosing work and doing that by looking at their own personal values, interests, and preferences? So Christopher says that peers can add a huge amount of support for individuals looking for work through lived experience and sharing their own success stories. They are huge motivators for many people, absolutely. A plan of action and assessing cognitive abilities is another thing that maybe is needed to be assessed. So I'm going to talk a little bit also about values, interests, preferences, and skills, also some other resources that are available. And then once somebody looks at and identifies these, developing an employment goal that matches the person's values, interests, preferences, and skills. So we always want to look at how do we follow a path that takes a person from deciding and thinking about themselves and what they want and need. How do you set a goal or a plan for the person to get that job? How do you make that job match? All those things are very important. Person works at a job that matches their values, interests, and preferences, there's more job satisfaction and a person tends to stay longer in employment. Getting a job, gathering information, looking at how they will acquire a job. Once somebody chooses that job, the next step will be finding jobs that match their personal skills, preferences, and interests. In a couple of slides, I'll be showing you more resources about how both of these can assist somebody. But first, let's discuss ways someone finds a job they want. There are many resources available. There's hard copies that you can get at libraries. You can purchase them online that define jobs and talk about what's needed to be successful at different jobs. But this information, these resources are also easily accessible online. And I will be showing you some of those online resources. So once the information is gathered about a specific job or plan, that will guide them into how they're going to go about getting that job. So some of the plan may include skill development. If somebody needs education or training, if somebody needs interview skills, that could be part of the plan. Somebody decides they want to be a plumber. What skills do they have? What skills do they need? Part of the plan will include skill development. Maybe they need interviewing skills. Resource development may include a resume, maybe interview clothes. They may need an accommodation at the interview stage, or thinking about an accommodation once somebody starts working, such as accommodation could be very informal, such as I'm going to work a second shift job, I'm going to work starting in the afternoon because I have a hard time getting up in the morning. So once you develop a plan, then you implement this plan and revise it as needed. So let's talk more specifically now about the values, interests, preferences, and skills. One of the best ways to assess somebody's values, skills, interest is through a conversation. So just talking to somebody, encouraging a conversation about work is probably one of the best ways to gain information. Asking questions like, well, what do you like to do? What did you like about that job you had? What did you like least about the last job you had? It will tell a lot about a person's value if you listen for the underlying message they're expressing. For example, if someone says, I love my last job because I worked with the people, I really liked the people I worked with, they were friendly, they were helpful. We got a lot done when we worked together. So what are some of the values that that might be expressing? I loved my last job, and the people that I worked with, they were friendly and helpful, and we got a lot more done when we worked together. So some of those values that are being identified from that conversation would include friendly coworkers, maybe a supportive employment, socialization and community teamwork, working as a team. So just having a simple conversation. If somebody talks about what they didn't like at a job, say, I didn't like my last job because my boss was mean, then a value might be that person would like a supportive supervisor, would like a friendly work environment. So even though this is very informal, it's a valuable way to gain ideas about what's important to a job in their values, their work values. So now I want to also show you, and I'm going to actually link into a couple of these, some of the online sources that are available. And this particular page talks about values. How do you assess, or how do you help somebody in a more formal way with assessing? So one of them is this value card sort. And we're going to share that screen. Takes a second to come up. So just to let you know, I think this is 10 pages. I don't want to scroll down and get you all dizzy, but it's got several pages. This is an activity that you can do with people that has all sorts of different work values. And you can see up at the top, it talks about what's important to me, what's very important to me, what's not important to me. So if you cut out these cards and you can have people identify in those three categories, what of these work values fits into which of the categories. So then after they do that, those things that are most important to them, they're going to have a stack of cards that will help identify what some of their work values are. It's a fun activity. People enjoy doing it, and it offers some really valuable information. Okay. So I would also like to open up and share a second resource. This is another more formal way to assess somebody's values. This is done online. I'm going to scroll down here, and over to the left, there is a list of different values and say this efficient work habits. Say, I'm not so sure if that's valuable to me. I'll put it in neutral. Creating balance in one's life, that's really important to me. So a person goes through and moves. Professional conduct is important to me. So you go through, and the person could go through each of these values and put them in different categories. And then it helps you sort out what the mean. You submit it down here at the bottom, and it identifies some work values. And again, people enjoy doing something like this. And for right now, I think that's the only one. There's other resources here. I'm going to, I might go into this last one too. I'm not going to go in all of them, but I'm going to encourage you to explore them. They're fun to do yourself, and they're fun to help somebody else do them. Okay. Over here to the left, so this is another site, Career One Stop. Over to the left, you can see under self-assessments, talks a little about what assessment is, but it also gives you an interest assessment, a skills assessment, and a work values assessment. And so if you go through and identify, use those assessments. Again, it's a fun activity to do. Again, a conversation is one of the best ways to glean information about interests, values, and preferences. So some other approaches besides conversation, making list of interests, talking to a person about their areas of interest, what they like to do, what they thought was interesting. There's also job shadowing, where a person can go, and it can be informally. You can go with somebody to a job site and have them watch what another person does. They can, you can contact and make it a little bit more formal, so somebody can come in, actually engage and talk to them, and talk to other employees that they watch, and discuss what do they like about the job, what don't they like about the job. So here's another way of identifying some preferences and interests that a person may like. I'm also identifying for you, and on the screen should be two more formalized paper and pencil type inventories. One is the Holland self-directed search, and it's got a website where you can do an online version of it also, because these paper and pencil inventories do cost some money. The other one, the career exploration inventory, is another one that can be ordered. The SDS is one of the most thoroughly studied in sound assessment tools. It's been in more than 1,000 studies. It was developed in the 70s, and it was revised in 2017. It asks questions about an individual's aspiration, activities, competencies, and skills. The CEI, the Career Exploration Inventory, helps people to explore and plan for work, leisure, and education. This tool helps people identify work, leisure, and learning activities related to their career goals, but also helps them to explore, in general, more transferable skills. And they use the cluster level, which is a different way of identifying and organizing jobs. So you will find, even online, when you use different inventories and you go to different sites, many of the sites use Holland's self-directed search and the way that they identify and categorize jobs, and some of them will use career clusters, which is 16 clusters, career clusters, and there's 6 categories for the Holland search. So I think one thing that is important, and if nobody's used it before, is this ONET. It's an online database that has over 900 occupations, and I'm going to walk you through that a little bit because it has so much good information, and then we'll do a little bit of exploring of the America's Job Center. So what I'd like to, why I get into this particular, the ONET, so we can walk through that, I'm going to ask somebody if they will identify a job they would like to explore. And we're going to use that as an example. So here's the ONET. It should be up on your screen now. Community Engagement Manager. Okay, that's a job I've never heard of before. So I'm going into what's called, under Tools, My Next Move. And I'm going to type in public relations, fundraising. Let's do that one at the very top, just for an example. So you can type in types of jobs, and then if you go into a specific category that you found that you really like, this one is public relations and fundraising. So to look at that, it will give you lots of information about this particular job. For somebody who's looking on to choose a career and what they like, this is a way for them to have a better understanding of what's expected at a job and what their skills may be needed. So it has a knowledge base, a skills base, your abilities, down here personality, technology skills, the types of education. For this particular career, bachelor's degree or some college is needed. Job outlook is bright. It will tell you whether or not it's a growing field or not, and a bright field is growing. You can see the wage spans between $64,000 and over $200,000, with the, I guess that would be a mean salary of $14,000, excuse me. So it's a lucrative field. And then if you want to explore more, over to the right you can. So this gives you more information about any particular job that you would like. So it's kind of fun to play around. If you become comfortable with it yourself, it's fun to assist somebody in working through this and finding out more about jobs they're interested in. You can also see up at the top that there is a watch video. So if you were interested in having somebody watch a video about those particular kind of jobs, then there would be a little video clip that would go with it. So I want to show you one more, the America's Job Bank, because this has really good information also. That's a little bit different, and also provides a lot of really good information. You can explore careers, talk about skills, salaries, what kind of training you may need, and job listings, resumes, interviews. So it's got that information there. It does have some videos that go along with it. So I just wanted to show you that, different kind of video clips. But one of the things that I think is important at this site is find a local help. So the American Job Center. So again, I'm going to ask somebody if they would like to, I had in here my zip code, anybody has a location, a state that they would like to find out where their career centers are that can actually help somebody with finding employment. Anybody? Okay, so. And I put in 25 miles. You know, you can change the mileage around. So for this particular zip code, the 82801 is the Sheridan Workforce Center, and it gives an address, the hours, and a telephone number. So this is a resource that you can use to actually assist somebody with being able to find a career center. I'm going to put in one more. And so this one has several locations. New York, of course, that's why. All these different locations of where you may be able to find it. So this is another really good resource for you to utilize in finding places to assist somebody with actually getting that job. Having a little difficulty with getting my slides to move forward. There, needed some technical assistance. So we talked about choosing a job, getting a job, and the resources that I just showed you will assist in both, in deciding the values inventory, the preference inventories or assessments, and then getting a job. Where are those jobs? What jobs match my values, skills, and abilities? Once somebody gets a job, it's vitally important that we assist and help that person in keeping employment. So there's an ongoing support plan that is important. I think sometimes what happens is when somebody gains employment, we think our work is done, when that could be one of the most vital areas in supporting somebody with keeping their job, working through any issues that may come up. And then the WRAP Wellness Toolkit is also another way to help somebody stay well and identify any triggers or things that may interfere with their ability to be successful in employment. An ongoing support plan could include things like work performance, work environment, and potential barriers. So I just want to say a few things. Under work performance, some of the things in the ongoing support plan you may want to talk about is, just finding out how are things going in your job. How would you rate your performance in a job? Has your job description changed? Sometimes things change on a person and that, a job wasn't what they thought it would be. Now's the time to have a discussion, help somebody work through any issues or problems that may come up. Have you had any problems getting to work on time? Many times people aren't necessarily going to tell you if they're having problems. So engaging in a conversation to make sure that they're providing you with the information that may be needed to help them work through any problems. So that's work performance and duties. Work environment and culture. How do you get along with your boss and your coworkers? Sometimes that's one of the biggest issues that interferes with a person being able to maintain their employment. How about relationships at work? Do you have any occasion to socialize with coworkers? Are you able to budget your money in order to afford what you need? Is also a very important question to ask. And then potential barriers. Asking about symptoms or medications that may be interfering, any physical problems that may interfere with their work. Scheduling, does that interfere with their medical appointments? Working with somebody to make sure that they are maintaining their health along with having employment. Sometimes they interfere and they need to make decisions about how to make it work for them. And transportation, reliable transportation. So those are two things that once somebody's employed, again, a conversation, finding out what's going on, developing a plan to help that person. If they're having trouble with getting up in the morning, what's the plan to help support them? What I'd like to do now is talk a little bit about how other people in the mental health field, professionals, and this is specific towards clinicians, but I think it's anybody that works in the mental health field. It can include family members also. How does somebody that's not a supported employment person assist and support somebody in becoming employed? So that's what I'm going to talk about now. So some of the practice guidelines, first of all, will be clinicians can help the people that they're working with, their clients, and clinical teams to have realistic vocational goals. Sometimes people have been patients in a mental health system. They consider themselves patients or consumers or clients for so long, it's very difficult for them to see themselves as workers. So sometimes just helping somebody to understand that they are potential employees, they're potential job seekers, and a clinician or other mental health workers can support them. Help them identify strengths and skills that can be translated to work. You may have a really good understanding of that and be able to communicate that to the employment service people. Emphasize the therapeutic element of work. We can all encourage somebody to realize that work can be a recovery tool. Help them to understand that they can work as part of taking care of themselves. Sometimes individuals also overestimate or underestimate their abilities and support needs. So assisting somebody with having a realistic goal about what their needs are. Symptoms and wellness management, absolutely. Clinicians can also provide basic support and problem solving for somebody. For an example, a common support need may be anxiety prior to starting a job. So suggesting a phone call over the weekend, before breakfast, help them in decision negotiating transportation, and making suggestions. Say if somebody lives in a dangerous neighborhood, encouraging them to take a cab if it's late at night. So supportive clinicians help develop solutions where a person can assume responsibility in the community and work successfully. They work to help to ensure the client's satisfaction and sense of a self as a worker. So worker identity as opposed to a patient identity is another thing that can be reinforced by clinicians. Clinicians have insight from working with somebody, so they can assist in job matches, in strategies to manage the illness. They may know whether or not somebody likes a quiet place or a busy place. If they're very sociable, what might be a good place for them to work. And then the hours of work, what time of day is going to be the most conducive for a person to work and be successful. Clinicians can help their clients manage their illness. So working to stay well and healthy, making sure that their medications are appropriate, that their medications are interfering with their success at work. Those are all things that they can do. And substance abuse. That's talking about substance abuse is an important conversation because it can be a risk. Working at a job sometimes is what an individual needs or wants to stay well and to not use substance abuse. Sometimes jobs can offer additional monies that could make it a little bit more risky for somebody with a substance abuse problem. So having that conversation about how to manage money is really important. And this can be done at a clinician's or at another mental health provider as opposed to just a supported employment provider. Also helping somebody with interpersonal issues on the job, if they're struggling with working along with somebody. Okay, Danny Marquez is saying, as much as I agree clinicians can help, most do not agree with employment is a key part of a person's recovery. They see it as additional stressor. Yes, that's not an uncommon thought. And I think sometimes those of us that believe in employment as being such an important recovery tool, that part of our job sometimes is to help reinforce, to help educate for an individual to become employed. And it does depend on the individuals, but that might be some additional work that we as professionals can help our colleagues in understanding the importance of employment. And then so Christopher Coyle says that's where peers can help in a vital role in educating clinicians. Absolutely true. Thank you for that. So interpersonal skills, clinicians can help with that, working with people, working with bosses, struggling with those activities, how to make friends. Also working with families. Sometimes families can be the biggest support, or they can be the ones that also don't believe that employment is what their loved one should be doing. So having an understanding of the relationship that a person you're working with has with their family and how to negotiate assisting that person with becoming employed and waylaying the fears that a family member may have. And then clinicians can also help support their clients' long-term rehabilitation efforts by keeping a positive frame of mind. Absolutely important. I think believing in somebody that they can work, that I believe that you have the abilities and the strengths to be employed, that these are what I see in you that will make you a good employee, are all really important things that we can all do to assist somebody. So I have come to the section of questions and answers, and I believe Joni has been gathering some questions along the way, and she's going to, I believe, read some.
Yes, Francine, we've had quite a few questions. One question is from Anne Coons, who asks, how do you find a rehabilitation counselor in a state program who is experienced with helping people with mental health conditions? Offices sometimes claim that all counselors can handle people with any disability. So how would one find a rehabilitation counselor with the skills to help someone with a mental health condition?
That's a really good question. And I think Joni has some things that she'd like to say.
I was going to add in the Q&A written portion that there are a couple of websites that you might be able to start your search. The APSE.org, which is the Association for Persons with Supported Employment. They have an organization. There's also an organization called AskEarn.org. It's the Employee Assistance and Resource Network on Disability Inclusion, and also the IPSWorks.org. I'll post those resources in the Q&A section or the chat box.
Thank you, Joni.
Another question we had early on was from Danny, asking how labor market information is integrated into supported employment services.
Oh, it definitely should and can be integrated into employment services. And there's many other online sites where you can find those resources and that information. And I think finding a jobs that are growing and that are helpful in utilizing the information on workforce is really important. So I kind of forgot the question. I'm so sorry.
The labor market information, there's been some question there, you've been going in and out, so we'll try to keep close to the mic. Can you hear us now? Maybe someone can give a thumbs up in the chat. Another question that Christy had earlier on was she struggles with most of the participants that she's working with stating, no, I'm not going to work, I don't need to, with benefits, and my mental health is not stable. How do I get them interested in jobs? Christy talks about money and a better life, but it doesn't seem to get through to them.
Okay, and I think that's a very common situation. Conversations. Talking about individuals being, you know, what they're talking about, wanting a better life, wanting more, utilizing what she's stating in what she wants and how employment can assist with that. Maybe having her work with somebody from the WIPA or the benefits planner so that she has a good understanding of how her benefits can be maintained if she goes to work. And I think sometimes it's a long-term conversation that needs to be had and still. So can I ask, is some people are having a hard time hearing? Are you hearing it all? It cuts in and out. It gets muffled. Okay. All right. I totally apologize about that. So do you have another question, Joni?
Okay, so it was just a similar question. How do you find a rehabilitation counselor in a state? I'm going to read through the chat box one more time to just double check to see if we haven't missed any of the Q&A.
So if Joni just does that, I would like to just kind of bring it all together. I'm talking about the school life supported employment, IPS being evidence-based employment services that have principles that are very important to follow if you work in supported employment. But there's so many things things that other people can also do to help them with becoming employed. Elizabeth Lawrence, as a case manager, how can I navigate past barriers when a therapist disagrees with a client seeking or gaining employment? Conversation, I think, is the best way to do that. Any resources as far as published works that show that employment is not detrimental to somebody, having people that have jobs come in and talk about all the benefits that it has offered them, working on a team with clinicians to talk about employment. So Pamela, how can I get some of my participants excited to go to work or school? And again, I think conversations is important. Having a continual conversation is really important. And talking about the excitement, having somebody who's already working maybe come into a program and talk about the benefits that they have. Pamela also asked, how do you approach employers about hiring participants that are homeless and are dual diagnosed? How much do you reveal to the future employer? And I think that that's a decision that many different agencies and people make. I like to represent people with their strengths and what they can do, what a benefit they are as far as an employee goes, and not offer any disclosure about a disability. If somebody's homeless, I guess that's also managing a plan of how do you manage the person being able to hear back from an employer. Do they have, email access? Is that something that you as a professional can do to assist that person when they get offered work? So there's a lot of strategic things that need to be identified. So one more question is Vikisha. As some of you may know, some of the individuals we serve sometimes opt not to disclose their disabilities to employers. How can an employment specialist provide support for individuals who has a difficult time getting along with coworkers? Okay, you're absolutely right. A lot of times people don't want to disclose. I think if somebody needs an accommodation, disclosure may be important, but it can be done in such a way that it does not offer so much information that could be discriminatory to a person. As far as getting along with coworkers, I think that is a question that depends on what's going on with that particular person. I would assume that maybe that is a tendency that they have as an individual, maybe doing some anger management work. Again, discussion about how important it is to get along with coworkers. I would also say maybe it's not a good job match. Maybe there's another site where other employers or other people maybe work a little bit more. Work and have a little bit better relationship with people that they feel are more like them. Okay, Cynthia, I particularly work with youth, and it is difficult to have them be consistent with maintaining and staying long-term at a job. What resources or training can help this particular population? I think part of job maturity is changing jobs and finding out what you like and don't like. So it may be a process in their employment maturity that it may be poor job matches for that person. So I wonder whether or not it may just be a process that a youth is going through. changing jobs, finding a better job match may be the answer. Looking to see if there's one more question. So Devin says, how do you suggest finding these work opportunities when challenges with stigma and lack of motivation to participate in partnership with working with our members? Again, I think it is going out and doing that strategic job development. I know that some people that work in agencies, they work in programs where they're not able to go out into the community, but to have somebody go out and job develop and develop relationships with employers, meet with employers, and for the lack of a better word, sell the people that you're working with on their strengths and their abilities to do a job. Sometimes it takes a while for employers to understand that somebody has the skills and abilities and can be a successful job candidate and a successful worker, because what they see is all the things that they think are going to go wrong. So continue to meet with people, talk with people. Some employers may never come around, but developing relationships so they know that they trust you as a job developer is probably the best way. It's a lot of hard, time-consuming work to work with employers. Can you do your audio?
Are there any final questions or additional questions for Dr. Bates?
So,
okay, we do have one more. It's up a bit on the chat.
Matt?
Oh, maybe I think Francine answered this about the finding free opportunities. I'm going to write into the chat now the APSE and earn.org and IPS websites so that you can utilize those to access their supports to identify vocational rehab counselors in your state.
So is there any other questions at this point that we can summarize and change? I guess Joni's typing in now those resources. This PowerPoint will be made available to you also. And I thank you so very much for allowing me to share with you about supported employment.
And Anne or Connie, if there are any questions that we may have missed because I was typing or answering the others, if you could let us know, we will gladly address whatever questions may have been left in the chat or the Q&A.
Okay, looks like everything's good there. So thank you so very much for your time and consideration, and best of luck to your successes in working with individuals and helping them to become employed.
We have no more questions on our end, so thank you and enjoy your day.